Welcome. My name is Ty. We are in episode 3 of the Denver Prevention Training Center Summer Learning Series.
Awesome. Thank you for inviting me, Ty. I'm so excited to be here this morning.
So let's do some introductions. My name is Tai Edward Few. I use he, him pronouns. I'm the Associate Director of the Denver Prevention Training Center. So we've done, this is our third episode, so we've done 2 previously. In episode 2, our friend and colleague, Kiana Stallsworth, joined us to talk about the Denver Prevention Training Center's responsible data practices. And I know, Bev, you and I love talking about that. But I'm here today with you, Bev, my friend and colleague. Bev, introduce yourself.
All right. Thank you, Ty, and thank you again for inviting me. My name is Beverly Wasserman. I use she, her pronouns, and I'm the nurse field consultant with the Denver Prevention Training Center. I've been a practicing RN for the past 4 decades and then some. And I'm so excited to participate in this third episode of the Summer Learning Series. Today, our topic is one of my new favorites, Targeted Universalism in Public Health and Healthcare Settings. This topic is new to many folks, but it really is gaining popularity and people are starting to understand how valuable it is in their different industries. Targeted universalism is a strategy that can be used to make long-lasting, substantial policy and program changes that considers the needs of various communities. Targeted Universalism was developed by authors John A. Powell, Stephen Menendian, and Wendy Akey at the Othering and Belonging Institute, UC Berkeley. I had the good fortune to participate in a community of practice hosted by Seed Collaborative, where I was able to examine each of the 7 stages of targeted universalism and think about how we might utilize this strategy in healthcare and public health work. Thank you to Seed Collaborative for sharing their wisdom and information about targeted universalism that will really inform our discussion today. At the Denver Prevention Training Center, we partner with clients who work with communities across the country that experience unique circumstances when it comes to resources. When considering how to best utilize resources and serve the most folks in a population, the Targeted Universalism framework helps us co-create strategies to address the needs of those we are intending to reach.
So thank you, Bev. You'll see us doing a lot of different things today. We are going to Facebook Live through Zoom, and actually we're using Zoom to go to Facebook Live. So I am texting people all over the country to join us. So back to what we're talking about. So Bev, it sounds like targeted universalism can support the folks that we talked about in episode 2 who have been impacted by the social determinants of health. So let me just say this. The Denver Prevention Training Center has used the tactics and strategies from the Othering and Belonging Institute for bridging for staff and communities across the country. If you are interested in learning more about building bridges, email me tai.few@dhha.org, and I will send you the information for the Othering and Belonging Institute.
So thank you for sharing that, Ty. One of the other benefits I like to talk about as well when we think about providing targeted support to communities is sometimes we have these universal policies that don't really serve everyone. So during this episode, we're going to talk about one of our universal policies that we use in HIV testing as an example. So what do you think about that?
So when I hear this term universalism that comes to policies that serve a population, I think of 3 things that come to mind immediately: Social Security, family medical leave, and the minimum wage. Now, it seems that sometimes those policies still don't serve everyone who would benefit from that resource, Bev. Is that correct?
That is exactly true, Ty. You are spot on with that. And that's why using targeted universalism can really help us address some of those gaps that are inevitable with universal programming. We realize too that the reality is when we put out any universal program for a population, Again, it doesn't really serve everyone in that population in the ways we hope. A good example is we wouldn't offer universal policies for youth and children to an adult population, right?
They don't work.
Yeah.
So I see what you mean. So as we're thinking about targeted policies that serve a group of individuals with a particular need, this also seems that sometimes a lot of folks are left out, or that resource doesn't really make it to all the population. So it's that equally distributed across the population.
Exactly, you are right. Even though we know, for example, our communities that we just described who are impacted by social determinants that impact their health may need non-healthcare related resources to improve their health outcomes. We should consider looking at services every person in a given population needs toward reaching a universal goal as described in the Targeted
So
Universalism.
say that again.
Oh.
We want to consider services that every person
Yes.
in a given population needs to help reach a universal goal.
Exactly. Now, you have to be careful with that
Okay.
term population,
Oh,
because every time you're starting a targeted universalism project or model, you have to define who that is. And we'll talk more about that as we get into those stages.
okay. So now we've just laid out for you the difference between the difference in universal and targeted policies. Now let's look at this framework. So we're going to do something different than we have ever done on our summer learning series. We are going to share some PowerPoints with you that really go into what we're talking about. All right. All right. So producer Dane, can everyone see our PowerPoint?
Give me 1 second. I'm checking to make sure. Yep, we're good. We got it.
All right. So we're going to go through a series of slides that really talk about what is targeted universalism. We are not going to read slides to adults because we do not believe in doing that. We're going to amplify what's on the PowerPoint. So what is targeted universalism? So targeted universalism is a policy and a program development strategy that is really focused on targeted and tailored measures, programs, and interventions. Okay? Remember, this comes from the Othering and Belonging Institute at UC Berkeley. So then, the next thing we really want to talk about is why targeted universalism. So listen, here's the rub. If you're out there taking notes, this is really important. Targeted universalism it really seeks to raise everyone to a common aspirational goal. So underline that if you're taking notes, a common aspirational goal. This can be done in a couple ways. We can co-create goals, we can have a path, and we can have some distinct efforts. The most critical thing about targeted universalism, and we're going to say this today in many ways, in many different times, targeted universalism says at the core of us, we are all situated differently, but we are a part of the same social fabric. I want to say that one more time, that we are all situated differently. That means that everyone is different. We all have different and unique needs, but what are we a part of? We are a part of the same social fabric. And being a part of that same social fabric binds us in a way that are just as important as our differences.
Absolutely.
And at the heart of targeted universalism are two different things: disparities data and this idea of co-creation. Co-creation is essential to targeted universalism. So now I want to talk about why targeted universalism. So here's the thing about targeted universalism. It is really effective at creating necessary strategies that are either transactional, they are institutional, they're systemic, I'm sorry, I have a lisp, systemic, or they're structural. Or they really help us to achieve a collective or a societal aspiration, or it solves a problem that is a collective problem. Okay? So far when we talked about targeted universalism, we've said that A, it really looks at programs, interventions,
Policy.
or policies, that it really understands that we are situated differently,
Yes.
but part of the same social fabric, and that because of that, we can use this to make changes at a societal level and to achieve a common aspirational goal. All right. So now we want to talk about the 7 stages of targeted universalism. So this is what we're going to do. I'm going to read the different stages. Bev is going to talk about stages 1 and 2, which are really the heart of targeted universalism. Then I'm going to come back and move you through stages 3, 4, 5, 6, and 7. So here are the 7 stages, and you can see them on the screen. We want to co-create a universal goal, and we're going to talk about what that means. Emphasis on, and I'm going to give you a spoiler, we're going to co-create, meaning different groups are going to come together to create something. Then we're going to assess the general population's proximity to that universal co-created goal that we talked about. Then we're going to assess population segments, situated preparedness to that relative universal goal. Then we're going to look at the structures and systems that either support or impede each goal. And it's really important when we get to stage 4 that we talk about the issue that systems are not neutral. We're going to get to that. Then we're going to develop and implement targeted strategies. And the targeted strategies go back to that universal goal. And all along the way, people have been bought into the process, not just those who are impacted by the problem, but those who are also not impacted. And then the best part, we're going to develop messages to support that. And then we're going to do the part that we all love, is we're going to do measurement and evaluation. So Bev, I'm going to hand it over to you, and we're going to look at the first goal. Tell us about it.
All right, thank you, Tai. This is the fun part for me. I love digging into these stages. And literally this could take a long time with a group, as you can imagine, but it's so very worth it. So again, this universal goal is our guiding beacon for working using targeted universalism as a model. It is important in this stage to understand what the need is and how the larger population is included in the assessment. We also must consider the need for co-creation. Tai said that it's imperative. It's not really targeted universalism if you haven't co-created the process. Now, one thing, as public health and health delivery systems, we can be in the habit of building a program and telling the community what we're going to do. That's our, our habit to do things that way. Targeted universalism can be an effective strategy to gain not only buy-in from community and stakeholders, but understand more about the problem we are trying to address, especially from those who are being impacted by it. Everyone should be prepared. This stage takes time, right? You're bringing stakeholders together. You're trying to get consensus. You're assessing data. There's a lot to get done in this first stage. And you're defining who is everyone. When we say universal goal, that can look very different. And we're going to give you an example from our work in HIV. So again, we are thinking about funders, community members, decision makers, folks who work on data, and those uniquely impacted, as you said, and also those who are not impacted, but they're part of that societal fabric that you talked about. That's the difference here, is we're pulling everyone together.
So wait a minute, Bev. Wait a minute. So in this first step, we are going to co-create a goal. And so the co-created goal considers everybody. Why are we considering those who are not impacted? If I don't got the problem, if I'm not impacted, why are you considering me?
That is such a great question, Tai. Again, what we know for sure, if we consider that target universalism goals are meant to include a population. Some of those folks are gonna be at that goal already.
Okay.
And you say, well, why would we ask them what to do? they are also part of this fabric, and they may also be impacted
Okay.
in ways they haven't thought about, or they may tell us ways that people are being impacted from their particular population group that we never considered. So it really is part of that co-creation piece to not miss out on having broad perspectives. Does
So
that help?
It's that downstream effect. So even if I'm not impacted by the problem, something else associated with that problem could be
Exactly.
impacting my life.
And it creates that engagement that we're all working on this together.
Okay.
So let's look at our example we talked about from HIV services. For example, our national guidance tells us that everyone should have between the ages of 13 and 64 needs to get a screening test for HIV. That's our national guidance from our federal funders and guidance folks. This is broad reaching, right?
Broad
This
reaching.
and we're covering generations, age groups, we're all across the board.
Ethnicities, genders, all of that. 13 to 64, that's a wide range of people.
That's a lot of people.
I'm in that group. You know, I'm
Are
14.
you still in that group?
I'm
Okay.
14. I'm 14.
Well, first off, people need to know about the recommendation. Let's start with that. They need to access a clinical site, a laboratory, an HIV testing site, which in some cases means having insurance, having ability to pay, ability to get to the testing site. So all these things you can see, while this is a universal goal, everyone may not be able to acquire and
Okay.
reach that goal. So that's where we do those targeted strategies and say, who's unable to reach this particular goal? So that's where, again, we said the targeted work comes into play, and we co-create with the communities experiencing social determinants and other barriers, like we just talked about, to really understand, again, people's situatedness and how that impacts their ability to reach this universal goal. That might mean, again, as we think about who might need some assistance reaching that goal, could be persons experiencing houselessness, lack of healthcare access, limited health literacy, or transportation barriers. So we understand really well in our work because we do a lot of this support for our folks we work with around the country to help them understand, well, how do you help your communities get to these services?
So that's stage one, co-create a universal goal. Tell us about stage two.
So stage two, again, this is where we start to drill down and get and decide who the population is. So for
Okay.
us, it's pretty easy. We're funded to take care of people living with HIV. That is our population group. But within that group, like you said, we have different age groups, we have different ethnicities, we have people who speak a variety of languages, et cetera, et cetera. So again, in our example, this is a wide range, but our population, we've decided, are people living with HIV. We continue to co-create with those who have lived experience and our stakeholders. Again, this gives us that broad lens. So in our case, we would actually have people who are not living with HIV come to the table and say, this is a goal we're trying to reach, even though this screening goal includes everyone. It's not just people living with HIV. So that's an example of how we would use this in our work. The other thing would be looking at places where there are limited or difficult access to HIV testing, such as our rural and frontier communities, which that is an area, again, in public health, in the work we do. We do a lot of work to address those distance to care barriers.
So that's stage one and two. So stage one was create this universal, co-create.
Co-create
Co-create a universal goal. Stage two is really define a population and then really understand the proximity from this defined population to the universal goal.
And those barriers. Yes.
So now we're going to look at stage three. So stage three is really doing this thing called an assessment. Now, if you work in any type of healthcare, if you do any type of policy work, the word assessment is something that you probably say 50 times a day. But we're not talking about a general assessment. We're really talking about a granular assessment. and this is a unique step for targeted universalism. It really assesses the general population that we're looking at and trying to understand this population, this defined group, you said, defined and determined group, how far are they from this universal goal? So let's go back to our HIV testing example. If we're thinking about that, we want to think about which groups have access to a screening, to a tester, to the counseling that goes along with the testing, and which groups don't. And that don't could be for any reason. It could be the area code that you live in. There could be a language barrier. Maybe you don't have someone who speaks your language. I think about Native communities. Are people going out to those Native communities to do that work? So in that stage 3, you really want to assess the people's proximity, their performance, we use this word situatedness, which is just a difficult word. I don't like that word, but I can't get it out the English lexicon. But they're close to their relative proximity to the universal goal. So that's stage number 3. So we have 4 more stages to go to. All right, so stage 4. Sorry, we are just experiencing some tech issues here. So stage 4. This is the part that I love. We really want to talk about, and this is an I statement, we really want to talk about assessing systems and structures that really impact each group's ability to get to the universal goal. So in episode 2, we talked a lot about systems and structures. And so let me just take a moment to really define what we mean by a system and a structure. We're talking about systems or structures could be policies, they can be laws, they can be major systems within our government, right? Those things in many ways can help someone reach a goal or help someone not reach the goal. So when we think about this in terms of healthcare, think about who's going to pay for all of this. So if we don't have a pay source, people cannot get screenings. People cannot get access to clinical services. People cannot get the medical interventions and treatments that they need. And that is a system and a structure that will impede someone's ability to get to the targeted goal. So then we get to stage 5. And this is really critical because in stage 5, you are looking at ways that you can design and implement targeted strategies. So this is the part that gets people a little bit uncomfortable. So I've been thinking about how to break this down. So in this stage, we are looking at how systems and structures express what we call othering and belonging. And I want to break this down. Systems and structures are not neutral. Systems and structures have consequences that sometimes are intended and sometimes unintended.
Yeah.
So let me give you an example. Picture it. It's Cleveland, Ohio. It's 1971, 72. And my father realizes that in Black communities, there are no grocery stores.
Okay, we've seen that again, right?
Okay.
Time.
Now in 2025, we would call those food deserts or
Yeah.
food apartheids. And my father said, in order to really help this community, the strategy I'm going to do is to bring a grocery store into this community.
Oh, so your father was an early public health practitioner.
He was an economic practitioner. James was looking to make some money.
But it helps the community.
But the idea was that because of the way systems, and by systems and structures, in Cleveland, Ohio, we're talking about zonings, neighborhood, covenant contracts.
Yeah.
Because of all the way that existed, there were no grocery stores in communities of color, specifically Black communities. That was something that was expressing othering and belonging. That actually meant that either people did not have access to healthy food.
Right.
That meant that families were going hours to get to a grocery store if they didn't have a car, their own public transportation. So you see how that system
Absolutely.
is already expressing an advantage or disadvantage. Now, in public health and policy work, we talk about this all the time. When we think about systems, systems can unintentionally or intentionally express a bias, meaning some people have more access. So in the example that I gave, the people who lived in those communities, and my father said there's no grocery store,
Right.
they had a disadvantage.
Exactly.
But other communities where the grocery store was centrally located, it was near bus lines, it was near public transportation, that
Right.
was an advantage.
Yeah.
So I'm going to say this clearly so that everyone understands. Systems and structures can express othering and belonging. We can say this clearly and again, that systems are not neutral, and we need to be okay with that. Because remember, the beauty of targeted universalism says that we are all situated differently, but part of the same social fabric.
Yes.
So looking at the people who were situated differently in your communities, how those systems are expressing access or lack of access is something to consider. And so in stage 5, getting back to targeted universalism, in stage 5, what you really want to do is you want to understand how to design and implement strategies that really help those defined populations address movement to the universal goal.
Exactly.
Okay? Then we get to stage 6, which is the power of story and messaging. In stage 6, the desire, the goal, what you're doing in that stage is co-creating new narratives where people can see, people who have not been able to get to that universal goal, can see themselves reaching that universal goal. And so that everyone creates these narratives. This is important because that means people can buy in. So going back to the grocery store, Dad says, I'm going to put a grocery store in this community.
Right.
What I'm going to do then is hire people from that community to work at the grocery store so that they can see that this is a part of their community.
Yes.
So that everyone can participate in this vision, and here we are reaching that goal. So that's the important thing. And you are creating new stories. Stories are important. Stories are how we learn. What I just told you about my father is an example of someone using a story to make a concept concrete and then breaking that down about how you can use it. So stories are critical. If you can develop a message and a story that ties to people reaching that universal goal, you're really going to help the community advance. And then we get to our final stage, which everybody knows about.
Right. We never leave this out in public
This is
health.
important. So we are talking about doing an evaluation. So we are going to really think about what is that progress that the defined and determined communities have made towards reaching that universal goal. How effective were the messages and the strategies so that we can take that information and continue this process of really reaching the strategic and the universal goal. So those are the 7 stages. So, Bev, let's just kind of do a quick review.
Okay.
So there's 7 stages.
Yes.
Tell me about stages 1 and 2 again.
Well, again, that's where, again, we really land on what is the problem.
Okay.
And let's create a universal goal. Let's define our population. We do that between stages 1 and 2. We figure out who should be at the table. And there's a lot of people, we talked earlier about the idea that people not impacted. But I think one example comes to mind, and your father's story matches nicely in that small business owners, they benefit.
Yes.
When the community is thriving and able to shop, etc. So again, we think about all these stakeholders, public health funders. We in healthcare, if our patients are healthier, there's less healthcare cost. So those are just examples of those first two stages are really key, and they can take a while just to develop.
Not only can they take a while, those first two stages are full of starts and stops.
Yes, exactly.
And those stops and starts are a normal process of moving an innovation and a strategy into a population.
And trust, right?
Yes.
We're building trust.
Yes.
We're getting to know each other. We're starting to understand our situatedness.
Yes.
Right? Though it's unique, we all can see the beauty of, wow, it would be nice to have another grocery store on my way home from work or whatever the item is. Or for us, it's about getting people access to testing and all the parts that go with that, the counseling, seeing a provider, et cetera, and just healthcare access, all of those things.
And then stages 3 and 4 are really about assessing.
Yeah.
You're doing a granular assessment. You're thinking about how far populations are from this universal goals and what do we need to do. And then in stage 5, you are dealing with this. Stage 5, you are thinking about designing and implementing strategies that really address the systems and the structures that prevent people from reaching that goal. Or what are the systems and the structures that are helping people reach that goal?
Exactly.
And then in stage 6, you are doing the messaging, you're creating the stories, you are inviting the storytellers, you are inviting that creative part into people visioning, what does this look like?
Exactly.
How am I benefiting in this?
Where's my part?
Where's my part? This is how my community participates and grows. And then in stage 7, you were evaluating.
Exactly, and we're co-creating all the way through from start, and there really is no end, but all the way to that 7th stage. So yeah, and you can see how ultimately what we're looking for is, have we had movement toward the universal goal? Have we had folks who were further away move closer? And that's how we know we've actually done something that's been effective.
And targeted universalism. I'm going to say this again just so people get it. Acknowledges from the beginning that everyone is situated differently. It's a beautiful language. It's a language that is resonating with our current times. And even though that we are situated differently, we are still part of the same social fabric. So that if I'm hurting, you're hurt, right? And then targeted universalism also says, we want to also look at the disparities data. What's going on? And then we can co-create based upon this disparities data that does not exclude those who are already benefiting. We're going to bring those people in to the conversation.
Because we don't compare between groups. We're all trying to reach the universal goal. That's the beauty of it, and that's the call in for all of us, that this, whatever your population is, whatever the work is, it's about your population. It could be your city, it could be your state. So
all reaching a universal goal. So that is targeted universalism. So remember, this theory or this strategy comes from the Othering and Belonging Institute out at UC Berkeley.
Yes.
John A. Powell's, if you type in, and there, John's name is all lowercase. So if you type in John A. Powell, don't do uppercase J, uppercase A, uppercase P. I'm sorry, no uppercase P, and just type in John A. Powell plus Othering and Belonging Institute. You will get to their fabulous page. The Othering and Belonging Institute is really concerned, and listen to us in public health and people who are doing strategy, about building bridges. And so this targeted universalism is a way to build bridges so that even though people are situated differently, we can get to a co-created universal goal. So check them out. So now we are at that part in our time where I look over at my good friend, Producer Dane, and I ask Producer Dane, what questions do you have for us?
Yeah, we got a couple of questions. I think one thing people are curious about engaging with is just how broad can co-created universal goals be, right? Like, I think trying to engage with this idea of like, can they range broadly across kind of our health systems, or do we need to narrow it down to a specific population? Like, talk about some of that.
You actually don't. That's the beauty of it. For example, I'll throw out a recent example we've seen in some of our legislation and ideas for legislation. Medicare for all would be an example of, oh, we want to reach. Really, I don't know if they were considering looping children in that group or not, but it would include probably all of the adult population. Now, we know that even if we had, say, insurance that covered all of us in the US, different folks would have different access issues for a variety of reasons, like getting to the services. Because we always end up, anything the service doesn't cover, like the global universal goal, if the resources don't cover that, where is that money coming from? And there's certain groups who will need more assistance, like we talked about earlier in our HIV example.
The elderly, people who don't live in population centers.
Exactly. So yeah, it can be really broad. It can be very broad.
Great. Another question was about the systems and structures aren't neutral,
Yes.
that key point. I think there's kind of, you know, a flip side of that is recognizing that those unintended consequences that might come about, right?
Mhm.
And so I think like there's the question is about kind of how do you convince people it's worth the risk, right? Of like not knowing what those unintended consequences might be. How do you get people on the same page to put something in place to try it and see what happens?
So I'm going to be very honest. I think this is a not that I lied before. I lied about everything I said. But one way to think about this is that you are really trying to get people who have benefited from a system to understand that there was nothing about them that got them that benefit. It's not because you were talented. It's not because you were good looking. It's not because you had good genetics. It could simply have been an accident of birth.
Exactly.
And it's getting people to understand that benefit should then go to everyone. That you should not be the only person that benefits. At the same time, you are saying to people who have always been browbeat by systems, give us an opportunity to create a system that will benefit you. Now, asking people to do that means you're doing 5 things. 1, you're asking people to trust you. 2, you are asking people to really consider how much time it's going to take to create, revise, and redo. Create, revise, and redo so that that system actually does benefit. 3, you have to immediately acknowledge past failures and be honest about how systems have failed people in the past, right? 4, you are really asking people to envision a world in which this system does work. And 3 and 4 are difficult because they are that group of people who have not benefited are living under the pressure of that unequal access. And 5, you are going back and you're asking people to trust people who have wronged them in the past. And so it's not an easy thing to do. It is one where we should say, we've gotten this wrong in the past.
Exactly.
We want to do better. Now, us doing better does not mean that tomorrow the system's going to be great. It means that we're going to make 5 steps forward and 18 steps back. We are going to be frustrated with each other throughout this process. Here's a great example from history. After emancipation, Black men got the right to vote. At the same time, women were trying to get their right to vote. And there had been discussions within communities of color. Should we abandon suffrage for women in support of making sure that all men can vote? And what you're doing at that point is thinking about how the franchise of voting has advantages some and disadvantages others. And then you're asking those people who have never had the opportunity to either wait a minute or support this other group, and they can't see how they're going to benefit from this other group getting it. So there's this tension, and we need to honor the tension, and we need to work through the tension, and we need to be honest about the success we're going to have and the failure we're going to have.
That's great. I think this question is kind of along similar lines, but talk about your thoughts on scalability of this idea, right? And like, because I think it can
Yeah,
seem,
we have.
with all the challenges, it can seem overwhelming, right? To even
Yeah.
try to go down this path.
It can, but in many ways, number one, the thing that drew me to Targeted Universalism is it aligns beautifully with public health practice. These are, though there's some nuances that are really important that we talked about, like looking at systems through a different lens and thinking about looking at the universal goal instead of looking between groups to look at disparities. So there's some unique pieces, but a lot of it are things we do. We do community engagement in public health. We've done a lot of starts and stops with different projects for communities. So we have a lot of understanding of how this project might work. The beauty is I shared this in a meeting the other day, in that you're setting yourself up to have more support. That could be financial support, legislative support, community support, because you are the co-creation is really the foundation of making sure that more people see themselves as part of it, see themselves as beneficiaries. Also for us in our work practices in public health, healthcare, we want to know what we're doing helps people. We want to implement strategies that actually land and do something. Using the targeted universalism process really helps you stop at each stage and look at how are we gonna, once we get by the time we're at stage 7 and we want to compare, who's moved on this universal goal, we understand that we've taken all this time and effort to tailor this and to continue with, as needed, the stops, the starts, the sometimes being very frustrated with each other, and then telling a new story. That new story was created through the process. So it is something that would take time, but it also could have you in a situation where you'd get funding, like grant funding, that you wouldn't have accessed before, because you've pulled in more stakeholders and using a broader population. So there's more people to benefit. And again, legislators want to see that. Think about their constituents. They're looking at, how do I serve all my constituents with whatever we're trying to fund? So it is a strategy that helps us reach more people and get more buy-in.
And to continue the thread, sometimes when people talk about scalability, what they are asking is, how quickly can this happen? Not can we scale it, but how quickly can this
You're right.
happen?
It's like
And we need to be honest, the systems and structures that Targeted Universalism are seeking to change did not go up yesterday,
exactly.
which means that they won't be revised this afternoon. So scalability also says that it's going to take time to get the right people. So I think about stakeholders and stewards. It's going to take time to get all the right people at the table.
Yes.
Forget the table, to get all the right people in the room, to find out what the room should be. And
Right, yeah.
it takes time to do all that.
Yeah.
And then as we are situated differently, we're situated differently because not just systems and structures are evolving, but there are pressures on those systems and structures
Exactly.
that cause evolution that we're dealing with. So it can be scalable, but it won't be immediately. It's not a vaccine.
That's right. That's not a vaccine.
Great. This isn't a question, but it's actually a reflection I had
Okay.
hearing about stage 6 on the
Producer Dane does this all the time.
Okay, I love it. I love it.
hearing about the stage 6 of the messaging and the stories for supporting new strategies. I was thinking about I had a mentor tell me once because it's easy, like when you're creating a new initiative, to like get bogged down in the details and get overwhelmed by the data and all these sorts of things going on.
Mhm.
And to help like zoom me out, my mentor just told me to think of the question, what story do you want to tell?
Mhm.
Yeah.
Like, what story do you want to tell about this
Exactly.
initiative that we have? So I was thinking about the grocery store idea, right? Like we want to be able to say that we created this grocery store in this community that people were excited to go to. They could get affordable food. They ate healthier because of it, right? Like
Exactly.
it helps just align your goals, right?
Yeah.
And like think about those strategies that align with that.
My father would always think about what didn't exist, and then what's the story a couple of years later. Like, so
Right,
how
that's
are
that new
people
story.
going to benefit, right? And let's just be honest, America is a story.
Of course.
America is the story of a group of people who said, I don't like King George. I want to envision something different, right? And then it's a further adaptation on that story, each group putting their story or their chapter into that story, right? So stories have power. If you go to YouTube and you type in the power of, or TED Talk, there's a TED Talk called The Power of a Single Story. You should watch it because it's really would really help us understand how to talk about things, how to get people to participate in systems. Yeah.
That's all we got.
Well, thank you for coming and Beth, thank you for Targeted Universalism.
Thanks to the Othering and Belonging Institute. I can't say how it's just impacted me knowing this process and this strategy, and I am sharing it to as many people as I can in public health and healthcare systems because it really does align with our work of serving communities.
So a couple things as we close. We're going to do our usual closing.
Okay.
We are going to be at a couple of conferences. So next week, our team will be at the Circle of Harmony conference in Albuquerque, New Mexico. The week after that, we will be at the United States Conference on HIV and AIDS in Washington, D.C. See us there. Come out and talk to us. Finally, our fourth and final session, the Summer Learning Series, is going to be September 25th. The medical director of the Denver Prevention Training Center, Dr. Sarah Rowe, is going to come and talk to us about syndemics. And so it'll be a little bit of a different talk. It'll be more clinical. So get your notepads ready. We're going to take you there. Finally, I just want to say thank you to everyone who helped us record today. So thank you, producer Dane, our other producer, Kim Weeks, for our technical supports from John Fitch. And thank you to my friend and co-host, Bev Wasserman. I've been wanting to get you here for a little bit of time.
Well, thank you for inviting me.
You can always come on Zoom with me, and we can talk about other things. Maybe one day we'll talk about Toni Morrison and the power of those stories. All right. Well, thank you so much. Have a great day. Drink some water and do some good things in the world. Bye-bye.
Bye-bye.